joined the service in October 2017 and monitored how the service received referrals. GPs were referring in many different ways, and we needed to streamline this for the service. I linked in with Pat O'Driscoll in the HSE IT, and he pointed me in the direction of HealthLink. So HealthLink have a national template for referring in securely by GPs, and we adapted that to the palliative care referral form. GPs can send us in information directly. We're receiving better information, it's legible, and we get an awful lot of information about the patient's past medical history, their medication, next of kin details, and this allows us to review the patient in a prompt fashion. It's a huge honour to be shortlisted for this award. It definitely has boosted the morale of all the staff within the service, as everyone has had a part to play. It's in its infancy, and if it's a success, it will be rolled out nationally to all the palliative care services in Ireland.
I found that about 30% of our clients referred to us have low back pain, which is a huge portion of our waiting list. I found that these clients were receiving different treatments from different physios, were having mixed outcomes, but importantly they were often re-referred with the same problem, and thus our resources weren't being used as efficiently as we could. I set up the active back care programme, which includes exercise, education and a hydrotherapy service. So I looked at the waiting list and I found that by assessing, triaging and allocating the clients into low, medium or high risk groups, they could then receive targeted treatment. The outcome has been fantastic. The clients really enjoy it, they're happier, they're not on the waiting list as long, which is really important. Stratifying or targeting the physiotherapy intervention to the client is really important. So each client is assessed and then allocated into a low, medium or high risk group, and they have a targeted treatment accordingly. For me, I find that the clients aren't being re-referred as often, and really importantly, they have access to a new hydrotherapy service which is available in their community. Clients may access a class of up to about 10 people. They come and do a class based on Pilates or yoga here in the centre. I've seen that the clients primarily are much happier. They're on the waiting list for far less time. They are less fearful of movement. They participate better in their day-to-day lives. They get back to work quicker. They participate in their sports and their leisure activities, and very much it's a gradual process. They find that they are stronger, more flexible and fitter overall. On a bigger scale, I feel it's lovely to be part of a community that are all trying to improve the service from the ground up.
One key area and as part of our plan in 2019 was our children's respite services. We have 2 children's respite services in the north and the south of the county, and we've done a specific focus with our service provider, St. John of God Kerry Services, to focus on getting the best value for money from the service there. By looking at that in collaboration and looking at innovative ways of bringing children in and maximising the pairings of children who access the service, we've seen an increase in that service of over 328 beds over the year. I suppose that our respite services provide much needed breaks for the carers of children with disabilities. What we see is it gives an opportunity for the children firstly to go into respite services and stay overnight, but also take part in social activities and go to the cinema, mingle with their friends and really look at social goals for them and what they can achieve throughout that year. But more importantly, it is a valued break for the carers of these children who get a break for a couple of nights at a time in the month, and they get to do other things and focus on doing other things with other children in the family, but also other things for themselves, and it gives them that much needed break to catch their breath. I suppose what we've seen here is by doing this we've seen increased respite for all of the 70 families that we are supporting within those services. So by doing this project, what they would have got year on year, we've seen that increase of 328 bed nights. This validation is very, very important for the team. They've worked very hard throughout the year to work on this to make sure that these families are fully supported and we're getting value for money. So being part of the Cork Kerry Community Healthcare Awards is very, very important to the team. We're all delighted and looking forward to the evening.
Well, it's been a huge honour, and there's a lot of hard work that's been gone into this award really in the last year with both Michael and the rest of the team. So we're thrilled, really are thrilled to have been nominated. The volume of respite that we're able to deliver every week has gone up substantially, and we've had a huge amount of families calling in, grateful for the additional support that they've received. So as a team, it really has just spurred us on, and we're just so grateful to be nominated and so grateful that we were able to provide the additional hours to these families who so deserve it.